they said, impossible. Don't work on alcohol. Alcohol's so much a part of our life. Everyone drinks alcohol. Nobody's going to listen to you. There's too much money involved in alcohol, and no one's going to change what they're doing. The alcohol industry is very powerful in South Africa because it's so huge, because it has tentacles all across the continent, and because it's a big income generator in terms of tax and job creation, etc. So they've used the weak economy in our country, or the high, let's say the high unemployment in our country, as well as the weak economy in many countries in the region, as a motivating factor to go in their established factories like in Ethiopia, or, other countries, and saying we're going to bring in a lot of jobs, we're going to bring in a lot of income, but and they claim a lot of things about the multiplier effect, but there's no actual internationally accepted way of calculating the multiplier effect of what the industry brings into any particular economy. So that is a problem, and that is something we have used in the South African context, because we had figures for about a 3 or 4 year, in about a 5-year period, we had about 3 different figures from 3 different sources. So we were able to use that a lot to debunk what they were saying. The public needs to know actually what's happening and what's good or bad about what's happening for government to sit up and take notice. And that's, for us, has worked, because, and we obviously learn from other people, people were fighting apartheid, people were fighting the treatment action campaign, the way they did things. When we started working on our Phuza Wize campaign at School City, we tried to, because that's the way we usually work, bring all the stakeholders together who do work in this field. So either a government department like Department of Health or Social Development, Department of Basic Education, Department of Higher Education, as well as all the civil society organizations, as long as they were not funded by the alcohol industry, as well as the research institutes and academic institutes. So we spent a lot of time. We usually spend about 6 months meeting stakeholders at Soul City. That's how we do our work. So we've presented to them 3 or 4 times, I think 4 times, on alcohol and what should be done, and why we lobbying for these particular things like pricing, taxation, etc. And so that also strengthened those relationships. We share a lot of our research with them when they want it. We've been on the same panels with them, so that all of on the media, and because we're not saying to them you're not doing anything, but here's the evidence for what you can do, and this is the impact it will have, and this is how your government department will benefit. So we did that kind of mapping at Soul City in the beginning. We mapped out which government departments we needed to work with, and what's the win for them if they adopt what we wanted out of our campaign. Interestingly, the student representative councils and student organizations on campuses were very interested, and at least 4 of them have run the campaign during orientation, or they call us to do work dialogues. We call them community dialogues, but obviously these are now student dialogues, where we take the campaign and they run with it on their own, as far or as narrow as they want to go, but we share information with them. I think choosing the right research is very critical, and I think Soul City and our partners chose a population-wide approach, not an individual approach, and that made it easier for people to relate to what we were saying. Then showing the cost in South Africa, even though ours was a very conservative estimate, but it still showed us that actually it costs us more in harm than we earn from the industry. So that was one of the things that I think was very powerful. And the government, DTI, Department of Trade and Industry, did their own study, and they found it was double what we thought it was. We always said, even if it equals out, what we earn equals what we spend, what's the point? And how can we afford, as a developing country, to spend almost 17 billion on addressing alcohol-related harm when we've got so many other needs? They must pay as the industry that's causing this harm. And that's a very fundamental principle that generally we believe in as South Africans. addressing the structural drivers or looking at a population-wide approach is something we did very deliberately at Soul City when after engaging with our partners and looking at the easy availability of alcohol in South Africa, how cheap it is, what a strong social norm it is. It's pointless addressing individual level factors without addressing the structural drivers. So that's why we very deliberately did that. And we did get some criticism, in fact a lot, but we had to get people to understand why we're doing this. And it does work especially in the media. It worked with government as well, because they see the point of what we're saying, that you're going to go out with a lot of messages and people can't act on that because you're selling alcohol until 2 a.m. in the morning. And it's so cheap. It's cheaper than a loaf of bread. So it's absolutely ridiculous, to think you can do that. So you've got to address all those things first before you can expect the individual to change their behavior. So that's why we did it like that. And we strongly believe that was a good choice. Where alcohol marketing is concerned, we want a ban, because the international evidence shows that that's the best thing to do. Then we're wanting alcohol outlets to drastically reduce their hours of sale. So right now they can stay open until 2 a.m. We want them to reduce that on weeknights to 10 p.m. and on Fridays and Saturdays midnight. So that's very, contentious. That's actually the most contentious issue. The second most contentious issue is to reduce outlet density. There are far too many outlets in residential areas, and we're wanting those to be closed or to be consolidated, so 4 or 5 people on one outlet rather than having 4 or 5 within a 1.5 kilometer radius or something like that. In South Africa, we've had some good progress this year. Because we had the national norms and standards for all alcohol outlets released in February, like reducing hours of sale and insisting on IDs, making water freely available, that kind of thing. So generally we felt, we felt that there's some sense of progress, and the regulations are expected out very soon. What they're saying is maybe you don't need to ban alcohol marketing in its entirety, but what you need is some kind of restriction, and alongside that they would support 2% levy on all alcohol sales, and for that to be redirected to address alcohol-related harm. So I think that that's a lot of progress, and it just shows that, if you continue to talk about these things and get evidence to back it up, you can make an impact, but you have to be in it for the long haul, and you can't expect to get everything that you ask for immediately. The other thing that surprisingly gets a lot of public support, gets support from all other government departments, is to increase the minimum legal drinking age, which we didn't want to call for initially because we felt that would be a very hard thing to win. And because the enforcement is poor. So you need to improve enforcement for that to actually work. But we're seeing that even the Liquor Traders Association are supporting that. There is evidence to show that it is better to increase the drinking age. We wanted to present on the link between alcohol and HIV because we'd seen it coming up more and more in the dialogues that we had and in the community interactions that we were having. So we went back to the research. We found regional research and some international research as well, which made a very strong case. And we used that evidence to say that, that actually there is a strong link. And we tried to source more work. The South African National AIDS Council has taken that on board. We presented to them, we presented to their provincial, they have a provincial council where they bring civil society organizations from all across the country. They've highlighted it as one of the structural drivers. So they have a structural drivers committee in the South African National AIDS Council that has alcohol as one of the issues that they have to address, and they themselves speak about it a lot, and they've tried to integrate it into all of the work that they do. So it's been very good from that point of view, but we have to give credit to the research that we gathered from everyone else, including the Medical Research Council has a lot of work, and we've done joint presentations to SANEC on the link between alcohol and HIV. We're really excited about participating in this multi-country study on alcohol advertising. It's going to fill a very important gap for us because we don't have enough local research. Because, as South Africans, although we do look at international evidence and we value it, there's also a strong call internally I mean in the country, for us to have local evidence. And alcohol being such a such a strong part of our culture and social norm, people have resisted a lot of information because they don't want to change their behavior. So this kind of information will be a mirror to themselves, so it won't be, so it will be less easy for them to refute what we're saying. Whenever people listen to the voices of young people, it really makes them uncomfortable to see the world through the eyes of young people. So basically, through the study, they're going to see the impact of alcohol through the eyes of young people and the impact of alcohol advertising. And I think that's going to be really, really powerful. And I think that will also be encouraging to people working in the field to say, we've got new data, it's from the South, and it's addressing an issue that globally we are all wanting to address, which is to either ban or minimize drastically alcohol marketing.